Not every injury requires a trip to the hospital, but knowing which ones do can make a big difference in how quickly and safely someone recovers. Small cuts, minor burns, sprains, and bruises happen all the time. They occur during everyday activities: cooking, working in the garage, exercising, or doing simple tasks around the house. When something like this happens, people often face a quick decision: treat it at home or seek professional medical care. This choice can sometimes feel confusing. Some people go to the hospital for injuries that could safely be handled at home. Others delay getting medical attention for injuries that actually require professional evaluation. Understanding the difference between these situations can help people respond calmly and appropriately when minor injuries occur. The first thing to understand is what qualifies as a minor injury. Minor injuries usually involve small areas of the body and limited tissue damage. Examples include small surface cuts, mild burns from touching something hot, light sprains, small bruises, or minor scrapes from falls. These types of injuries often improve with basic first aid and time. Home treatment works well in many of these cases because the body has a strong ability to repair itself. When the injury is small and uncomplicated, simple care can support the healing process. For example, a small cut can often be treated by cleaning the area, applying gentle pressure to stop bleeding, and covering it with a clean bandage. The goal is to keep the area clean and protected while the skin repairs itself. Similarly, a minor burn may respond well to cooling the area with clean running water and protecting the skin afterward. A mild sprain may improve with rest, elevation, and reducing strain on the injured area. These types of basic responses are often enough for injuries that are limited in size and severity. However, the difficulty comes from determining when an injury may be more serious than it first appears. Some injuries look minor at the beginning but involve deeper damage. Others may carry a higher risk of infection or complications if not properly treated. One important factor to consider is the depth of the injury. A shallow scrape that only affects the surface of the skin usually heals without medical intervention. But a deeper cut that exposes underlying tissue or continues bleeding despite pressure may require stitches or professional care. Depth often matters more than the size of the injury. Another factor is the location of the injury. Injuries involving the face, eyes, hands, joints, or genitals may require closer medical attention even if they appear small. These areas contain delicate structures that can be affected by trauma. For example, a cut on the finger may interfere with tendons or nerves. A small injury near the eye could affect vision if not evaluated properly. Location can change the level of concern even when the wound itself appears minor. Bleeding is another important signal. Most minor cuts will stop bleeding after several minutes of steady pressure with a clean cloth or bandage. But if bleeding continues for an extended period or returns repeatedly, it may indicate a deeper injury. In those cases, medical evaluation becomes more important. Another situation that often requires attention involves possible fractures or joint injuries. A mild sprain may cause temporary swelling and discomfort, but the joint can usually still move and support some weight. If the injured area cannot bear weight, appears deformed, or produces severe pain when moved, the injury may involve a fracture or ligament damage. These situations typically require imaging and professional care. Infection risk is also something to consider when deciding between home treatment and medical care. Cuts caused by dirty or rusty objects, animal bites, or deep puncture wounds carry a higher risk of infection. These types of injuries may require cleaning techniques, antibiotics, or additional treatment that goes beyond basic home care. Another warning sign involves changes after the injury. If swelling continues to increase, pain worsens instead of improving, or redness spreads around a wound, it may indicate that something more serious is developing. Most minor injuries gradually improve over time. When symptoms move in the opposite direction, it's a signal that further evaluation may be needed. There are also situations where a hospital visit is recommended simply because the injury cannot be properly assessed at home. For example, if someone experiences dizziness, confusion, or loss of consciousness after a fall, medical professionals may need to rule out internal injury. Even when the external injury appears small, these symptoms can signal a deeper problem. The key challenge is that people often rely only on how an injury looks rather than how it behaves, but appearance alone does not always reveal the full situation. A small cut that heals normally within a few days is usually not concerning. A small cut that continues bleeding, becomes increasingly painful, or shows signs of infection tells a different story. The body often provides useful signals about what is happening beneath the surface. The most practical approach is to think in terms of 3 questions when deciding between home care and a hospital visit. First, how severe is the injury right now? Second, Is the injury located in a sensitive or complex part of the body? Third, are the symptoms improving, staying the same, or getting worse? If the injury is small, located in a low-risk area, and improving steadily, home treatment is often sufficient. If the injury is deep, located in a sensitive area, or showing signs of complications, medical evaluation becomes the safer choice. The goal is not to avoid medical care when it is needed. It is to recognize when basic first aid is appropriate and when professional attention can prevent further problems. Minor injuries are a normal part of daily life. Knowing how to respond calmly and correctly can reduce unnecessary worry while also helping ensure that serious problems are not overlooked. A simple understanding of injury severity, location, and progression can guide most decisions effectively. If you found this explanation helpful, consider subscribing to the channel. The goal here is to make everyday health and safety topics easier to understand through practical explanations.